Anxiety, depression, phobias, these are all conditions that impact millions of people. And our next guests say that they have a team that can help. Joining us now is Dr. David L. Hassan. He is with the St. Vincent's Primary Care, and also Emily Ventura is part of the behavioral health. She is a clinician there. Thank you. So good to see you. Appreciate you guys joining us. You know, we talk about going in and getting checkups to make sure that we are well physically. But also, Dr. L. Hassan, it is important, is it not, to make sure that we are okay mentally? And that's not something that's typically included when we go into those visits.
Yeah, you're right. I think just the term physical itself, when people think, you know, I'm going to the doctor to get my physical, that the root of that is because we do a history in physical. From the patient's perspective, a lot of times they think, what's the doctor going to do? What specimens are going to be taken? What are they going to physically touch and do? But if you leave alone all the intangible things and you don't screen for and treat behavioral disorders too, you essentially might as well not even check their blood pressure.
Because that could be at the root of the problem.
Correct. It's so essential that we look at, number one, the patient as a whole. We look at the whole picture. And it's just an injustice to the patient to not screen for those things in addition to that.
Emily, let's bring you into the conversation and talk about how working with a primary care provider, how that works with you as a mental health clinician.
Yeah, as Dr. El Hassan mentioned, our disciplines just work better when we're working together. We serve the patients better. Mental health issues can be affected by physical health issues and vice versa. So if we're treating them as a team, we just do a better job. It's really important for patients to have a medical home where they have a primary care doctor who listens to them and sees the whole picture, and having access to behavioral health within our same system allows us to do that better.
And I would imagine that the same answer would be true for you. It's just more information is better to have than not, right?
It sure is. I mean, at Ascension St. Vincent's, we essentially try to create the best medical home that we can for our patients, and that includes, for example, if I screen for and find any behavioral health disorder or mood disorder in any of my patients, I have a talk with them up front that includes, you know, my side of it is going to be any pharmaceutical treatment that I can offer you, but it's almost essentially a policy that I say we've got to pair that with counseling. The reason being, we know the studies show that patients do tremendously better when we pair counseling with professionals like Emily with medication assistance as well, versus one or the other alone. And when we have resources like we do at Ascension St. Vincent's, it's an injustice not to do that for the patient. Patients do tremendously better.
Yeah, and that speaks volumes in and of itself, to make sure you have those resources and talk about those resources that St. Vincent's has and is providing then to the patients and consumers out in the community.
Yeah, we're really working hard to build up our behavioral health program. We're a new program, and so we're starting just in the primary care offices, which, being located together, allows us to have really quick access for the doctors to get a behavioral health consult, or even for the doctor to introduce their patient to the behavioral health provider, which makes it so much easier for them to come back to that first visit. We're also partnering with other agencies to improve education in the community through mental health first aid training. We have a goal of training 10,000 people in the next 3 years, just education about what to look for mental health distress and how to assist people in getting the support that they need.
What would you say to those people who are watching who may suffer from anxiety or may find themselves suffering from depression or blue, but they find it hard to speak with that to anyone and they don't want to tell their doctor, but to your point, not disclosing that information may not reach a good outcome or a better outcome as if you were pairing that with a medical condition?
Absolutely. I think it's, number one, vital to normalize it for those patients. It's, you know, we know for sure that some 40+ million Americans live with anxiety disorders. We know some 15+ million American adults live with depression disorders. And we have to seek it out. We have to screen it to the best of our ability, but we need those patients to be open with us. We need those patients to be comfortable with discussing that with us. And we have to build a certain rapport with those patients. And I tell patients flat out, you know, when I offer them services, especially when I offer, in addition to medication, you know, we have professionals like Emily and her team, I flat out tell them, you know, listen, don't walk out that room of this, the door of this exam room thinking, well, that doctor thinks I'm crazy, he wants me to go talk to some shrink. It's not anything like that. I normalize it in the fact that it's not always a character trait. A lot of times we break it down to the neurotransmitter molecular level of your brain. And with Emily pairing her coping mechanisms that she teaches patients with, and me offering medicinal assistance, those patients just do tremendously better than if they don't open up to us to begin with.
So they might think it's just me, you know, it might be because
Correct.
I'm not sleeping well, it might be because
Sure.
it's just I don't know the way.
Yeah.
But you're saying it could be more of a scientific reason that you
Absolutely.
could treat on both fronts.
Yeah.
All right. Well, it's good to see you both.
You too.
Thank you for being here. We
Thank
appreciate
you.
you. And thanks to St. Vincent's Healthcare, of course, for coming on and making this possible. To learn more about the behavioral health at St. Vincent's, you can visit jackshealth.com/behavioral health.